You are not alone. You don't have to do this alone because you can't. And there are people out there who can help you. So if you can muster the courage to step out of isolation and reach out, there are people there who can help you.
Welcome to Beyond Theory, a podcast powered by Meadows Behavioral Healthcare that brings you in-depth conversations from the front lines of mental health and addiction recovery. I'm David Condos. Addiction thrives in isolation, and this can be especially true of sex addiction, which is often fueled by stress, shame, and unresolved trauma. So how does sex addiction therapist Dr. Invia Betjoseph help people slow down and focus on healing their wounds in the fast-paced world of Silicon Valley? Let's get out of the abstract and see how this applies in the real world. It's time to go beyond theory.
Well, hello, I'm Dr. Invia Betjoseph. I'm a licensed marriage and family therapist and a certified sex addiction therapist. And I'm a clinician here providing individual therapy for the sex addicts at the Meadows.
All right. Well, Dr. Betjoseph, thank you so much for joining us today.
Thank you for having me.
All right. So first, we'll start by kind of introducing people to you, your story, kind of the journey you took to getting into this work in this world.
Okay. So I started at UC Davis with the incredible endeavor of becoming a medical doctor, pursuing my parents' dream. And first semester there, I realized, no, I don't have what it takes to be a medical doctor.
It was not for you.
Not for me, not at all. No. So I realized that, I love listening to people. People always are drawn to me for that reason. So I dabbled in psychology and I fell in love with it right away. So I changed my major and I got a bachelor's degree in psychology. And from there, I pursued a master's degree in clinical psychology. And I got my license as a marriage and family therapist here in the state of California. And that was it. I was on my way of becoming a therapist.
Yeah. And so I know we were talking before we started recording, and you said that as you were kind of getting into this work, psychology, starting to work with patients, you saw sex addiction keep coming up again and again. Could you kind of talk about how you got introduced to that part of it?
Yes. Actually, the way it started was I was seeing the wives and the girlfriends. And I thought, this is a weird coincidence.
So the people with the sex addiction were not
coming in. No,
there.
not at all.
Okay.
But the wives and the girlfriends, the partners were coming in. And I thought, that is a weird coincidence. And so I was trying to treat them, but I honestly didn't know what I was doing. I was treating the anxiety, but there was more to it than that. And so I called my mentor and I asked her about it. And she says, it's not a coincidence. You're dealing with what's known as sexual addiction. And these are the partners, and they're going through a lot of trauma.
And they know that something's wrong.
They know something's wrong. They can't put their finger on it, but they're coming in with anxiety and depression. And so my mentor, Dr. Marianne Fifield, who's also a sex addiction therapist, she introduced me on this path. She says there's a certification, there's training, and it's done by Dr. Patrick Carnes, the pioneer who started this whole thing.
Who's also a senior fellow with the
You
Meadows.
got it, exactly. So I had no idea what I was getting into. I thought, all right, sure, I'll give it a try. Next thing I know, I'm flying to Arizona and getting training by the one and only Dr. Carnes.
Himself.
Yeah. So that was, to this day, an honor for me. And for weeks on end, we'd go back and forth, and I got my certification, and the people kept coming in.
Yeah.
And so,
but then you knew what to call it.
Then I knew what to call it, and there was a treatment for it. There was a name for it. They weren't going crazy. So that was the path.
Yeah. And so once you kind of had that training and you started to bring that back into your daily work, how did you get the people with the addiction to come in and like see that they could benefit from this and they were part of the whole thing? It wasn't just their partner dealing with the effects of it, but they needed to be a part of it as well.
So what I did was I asked the partner if it would be okay to see their spouse or boyfriend or whoever, if they could come in just for one session, just to help me understand what's going on and to help her. You
Mhm.
could phrase it that way,
Right.
like, you know, you could tell him, could you come in to help me? And so I would get him in, and next thing we knew, like, yep, he was exhibiting the signs, and I would ask the proper questions, obviously, to assess for that. And at that point, I would obviously have to make a decision whether I want to see them as a couple or, you know, treat him
Mm,
and refer
mm.
her to somebody else. And so word got around, you know, that I was seeing sex addicts, so they would refer their friends or their colleagues or whoever they were with.
But because it was so common, it was this kind
It
of
was so common, but
undercurrent.
no
Yeah.
one knew what to do with it. No one knew there was a name for
Mm,
it, and they just knew that they can't stop.
mm,
They want to stop, but they don't know how, and they were being deemed as perverts. And so there was a lot of shame. That's why they weren't coming out. So normalizing it in a sense that this is a mental disorder. It's called addiction. Despite your best efforts to try to stop, you can't. And it's just progressively getting worse and worse, you know? And so that helped a
It
lot.
follows the same path of other addictions, is
Like
what you're saying.
alcohol and gambling, yes.
Yeah.
Yes.
About how long ago was this when you started bringing
Oh, that's
this
a good
work
question.
back?
That was I'd say about 14, 15 years ago.
Okay.
Yeah,
So do you feel like it's come a long way in that
a
time, or
long
okay?
way. Oh, yes, yes. I mean, now there's research in neuroscience with brain spect images and functional MRIs where we can actually see the brain of an addict. And a lot of studies showed actually where they put people in the functional MRIs and brain spect images, and these were some cocaine addicts, and they also took pictures of the brains of sex addicts, and they were very similar. It was dopaminergic, which means that it was run by dopamine, the
Mm,
neurotransmitter dopamine. So I'm minimizing it right now, but
yeah.
there's a lot
But
of
the brain science was
the brain
showing.
science was
Yeah.
showing now. And so now we have some brain science to back up the treatment.
Mm. Does that help when you're talking with the addicts to say
Oh,
like, here's a scan?
here's a scan.
Yeah.
Here's what the brain looks like, a normal brain, quote unquote.
Mhm.
And here's what the brain of an addict looks like. And more specifically, here's the brain of a cocaine and brain of a sex addict.
Mm.
And their jaw drops at that point that, oh my gosh, you're putting words to what I've been feeling. I couldn't describe it. So it helps to uh, not just normalize it, but give it a name.
Mm.
You're not crazy. There is something about this. It exists, and you're not the only one.
Yeah.
And that was the most helpful thing for these people to hear,
That they're not alone.
that they're not alone.
Yeah.
Exactly.
And so you said earlier that, and even just now that I get the feeling that kind of the reaction is almost relief. So do you not see a lot of resistance? A lot of it is like, oh, I've been waiting for somebody to
Absolutely.
give me a name for this.
Absolutely. I mean, if you think about the shame that these men and women are feeling, uh, their worst enemy is isolation. So they put on a mask every day. They tell people what they want to hear. They show people what they want to see. But underneath all that is this fear of, if you really knew me,
Mm,
you wouldn't like me at all. You would hate me. So they go on pretending, lying, and being somebody they're not. And so when they're home and isolated, they can take off that mask because no one's watching, no one's hearing them, no one's seeing anything. And so they go living their life with a dual life. I mean, they have you know, a role that they play, so to speak.
yeah, yeah. And so you went to this training with Patrick Carnes.
Hmm.
Um, I, I guess looking at like his philosophy, his approach specifically, how have you seen those teachings play out in your work? Could you talk about kind of like the effectiveness or kind of how you've seen that work in real life?
Absolutely. Dr. Carnes introduced uh, all these clinicians with what he calls the 30 tasks of sexual addiction recovery. And some of the first tasks are about breaking the denial. And he talks about the many ways men and women stay in denial. For instance, minimizing is one, comparing themselves. Well, I'm not as bad as, John Doe there. At least
Mm,
I don't see prostitutes,
mm,
you know, or rationalizing, you know. Uh, So there's different ways, and he names like 12 to 14 different ways an individual stays in denial. So one of the first things we have to do is really break that denial and then find out what secrets they're keeping. There are a lot of secrets that they're keeping. So coming out of isolation in a very safe group or in a safe environment with the clinician is paramount. Their level of shame, the toxic shame that they feel. In fact, the late Dr. John Bradshaw used to say there's a difference between guilt and shame. Guilt says, I did something wrong. Shame says, there's something wrong with me.
Mhm.
Guilt says, I made a mistake. Shame says, I am a mistake. So for them, it's very strong. Having an environment in which they feel safe and not judged, kind of like, I get it. You did this because, all that stuff.
There are reasons
There are
behind it. There's
reasons behind,
underlying.
yes,
Yeah.
they can open up and not feel judged and shamed. That is paramount to recovery.
That's the first step.
First step is they need to feel safe and come out of isolation. They need to come out of hiding
Hmm.
because all of this is about hiding.
Right, right. And so you had this training with Patrick Carnes, who's
Mhm.
affiliated with the Meadows, and then now you're putting some of that into practice here at the Meadows Outpatient in Silicon Valley, California. Kind of talk us through how you got involved here, how you got connected with the Meadows.
That's interesting. I've always wanted to work at the Meadows, but being in California and the Meadows being in Arizona,
Mhm.
there was just no way. And I was having lunch with a friend several months ago, and he says, "Oh, Invia, I don't know if you knew this, but the Meadows is coming to Sunnyvale." I thought, "What? Wait, run that by me again." And he says, "Yeah," and he gave me the contact information, and the rest was history. I just immediately after
Mm.
lunch called the Meadows, and I said, "I need to talk to so and so." Got interviewed, and the rest is history.
Yeah, yeah. And so kind of on a practical level, what does it look like, the treatment that you're doing here at this location?
So I am doing individual treatments. So I'm an individual therapist for the patients here. They're doing group therapy with other clinicians. My job is to deal with the sexual addiction. Now, that can involve a lot of trauma work, in which case I'm also trained in EMDR. So making sure, first of all, that they are sober or they have a plan to be sober, which may involve a lot of 12-step work outside of the Meadows, doing the group therapy. But for my part, making sure that they're sober. And after that, do a thorough history and finding out at what point the sexuality, got
Kind of
misguided,
where
or
that started for
where that
them.
started from. What is their story? There's always a story, where sex got involved. And so all of these men and women are trying to cope and regulate their emotions. And the only way they have found is through sexuality. And a lot of people do it through gambling and drugs and alcohol. But being in Silicon Valley, where the internet is, paramount, it's
Mhm.
just everywhere. And it's so easy to access that kind of information. A lot of people choose the sexual route.
Yeah. And so using technology to
Using
feed that. Yeah,
exactly,
and so I
exactly.
want to dive into this a little bit because,
Sure.
like, as someone who is not from Silicon Valley,
Yes.
I have this idea of it being this community of, high tech, high stress, high
Hmm.
risk taking, very, digitally connected.
Hmm.
Um, how does all of that, how does that culture here specifically feed into what you're talking about with sex addiction?
It's a good question. With sex addicts, two things can be contributing to their acting out.
Mhm.
One is severe amount of stress, and the second thing is having no structure in their schedule. So an unstructured life coupled with stress can overwhelm them to the point where they need to find an escape, something that will make them feel just a little bit better,
Mm.
alter their mood. And so finding sexual material that's very intense can really increase that dopamine in their brain and alter their mood. So I have discovered that the stress and the unstructured life here in Silicon Valley is it's unlike anything I've seen. I mean, some of these engineers are working 65 to 80 hours a week. Uh, they're not coming home. And so now the stress of work is seeping into the life at home. If they're married, the spouse is getting upset. And so now there's stress at home. And so that can, you know, topple down into the work area. So that level of stress is overwhelming and they don't know what to do. And so now they're acting out at work and taking risky, involving risky behavior, risking actually their work
Hmm.
because a lot of these companies have a zero tolerance and they will get fired. And I've had a lot of patients who are engineers who have been fired as a result
For some of this
for
behavior.
some of this behavior because they can't cope with the stress.
Hmm.
So finding ways to cope with that stress, healthy ways, not um, unhealthy ways, is also another part of the treatment.
Yeah. And I like you talked about if you're working an 80-hour week in
Uh-huh.
a high stress environment, and you said like some of them don't even go home. So they're
Correct.
not getting those relationships, those
It's not
connectedness.
conducive to relationships at all.
Yeah. And so if that's your life, if you're not, and the human body is made for connectedness on
Absolutely.
that level, and you're not
Absolutely.
getting that, then this is just a natural kind of like explosion. Like it has to find it one way or another.
Yeah, and this type of addiction thrives on isolation and secrecy, And so if they're already involved in that behavior, um, they're going to continue, and then they're going to lie about it. They have to lie about it,
Hmm.
to maintain it,
Right.
and it's just going to get worse.
Yeah, yeah. And so, kind of talk about how like technology plays into this, because this is, especially here, this is like the hub, the birthplace of a lot
Hmm.
of the tech that we use all over the world. How does that feed sex addiction specifically?
Sure. So maintaining that uh, isolation theme, there's nothing like the internet. I mean, there was a time where you had to go to adult bookstores or buy magazines or just, somehow try to be incognito, but you can't, it's out
Yeah,
there. These
yeah.
days, you could access all of this information from the comfort of your own home.
Or your
It
phone, wherever you are.
phone,
Yeah.
yeah, wherever you are. I mean, it's accessible, it's it's affordable, it's virtually free, and it's anonymous for the most part. And so, for that reason, people are finding that they could just access it anywhere in this world. And now we're finding uh, teenagers developing some sexual problems, even erectile dysfunction because of the intensity, that is involved in these pornographic sites.
Hmm. And so, just like with using a drug, you've developed a tolerance. Is that kind of
Absolutely.
the parallel?
Yeah, the brain resets almost. It recalibrates and says, okay, now this is the new norm. Everything else is boring, so I need to access this. And you're constantly chasing that first high and trying to up the ante.
Yeah, yeah. And so it sounds like what you're describing here, the high stress, the lack of connectedness in real life, lack of
Hmm.
connectedness, coupled with the connectedness of the digital world in
You
air
got it.
quotes, that sounds like just a recipe for this like ticking time bomb.
It's a perfect storm. It's a perfect storm. You put it very adequately,
Mm,
yes.
yeah. And so how do you go about countering that? Because I mean, people who live here, if they work in the tech industry, I mean, that's the culture. Like that's almost what is required of them in some ways is to keep going with that high stress, nonstop lifestyle. So how do you get them to slow down and focus on what's really going on?
That is the biggest challenge here in Silicon Valley. And I get that these engineers have deadlines and they have a huge schedule. But I always offer the question, at what cost? What good are you if you don't take care of yourself? I mean, what good are you if you collapse or you die, because of a heart attack, So we have to implement some form of balance. Yes, work is very important, but you also have to balance it with self care. So we have to find ways, whatever is appropriate for them. And for some people, it's harder
Hmm,
to do that, but anything helps.
right. Yeah. And so you touched earlier on the idea of trauma
Yes.
and kind of its importance in this conversation. Could you talk about kind of how that plays into this and the connection that it has with sex addiction specifically?
Yes. So in my training with Dr. Carnes, he taught us through his research that when he assessed over 1,000 sex addicts, a lot of them had physical, sexual, and emotional trauma. In fact, 97% of them had emotional trauma. And that could be verbal abuse, that could be yelling. I mean, that's a lot.
Hmm.
And the physical and sexual abuse was pretty up there. It was between 70 and 80%.
Oh, wow.
Yes, that were. Now, there's a percentage of them that were not abused and they stumbled upon pornography or sexual material. Uh, but for the most part, there's some form of, you could call it lowercase t trauma as opposed to capital T, but some
Hmm.
of them have had that capital T trauma too. And so that, according to Dr. Basil van der Kolk, he talks about in his book, The Body Keeps the Score, which is
Hmm.
one of my favorite
He's
books.
another Meadows Senior
Another Meadows
Fellow.
fellow.
Yeah, yeah,
Yes, we're just so blessed to have these fellows. uh, that trauma gets locked in your body somehow. And so there are cues in our environment that tap into that. So when you are introduced to those cues, your body reacts. You can react emotionally or whatever, but there is that trauma. So after a level of sobriety and having recovery and doing self-care, then we can go into doing some of the trauma work and delving into the emotional, physical, and possibly sexual to heal that part.
yeah,
Because that is like a throbbing tumor that is driving this behavior.
yeah. And so when you were referencing the body keeps a score there, so what you're saying is that if somebody has, say, for example, sexual trauma in their
Hmm.
past,
Hmm.
then what you're saying is when they're introduced to that later in life, in the form of some of these things that can ramp up into sex addiction, then that's kind of a language they understand, or like their body is kind of drawn to that in a certain way because they have that past, or how does that work?
So whatever form of abuse they or trauma that they endure, the brain, the brain doesn't stop developing until like somewhere between 21 and 25 years of age. So the brain changes. And so the brain doesn't heal properly or deal with it properly. So as they're growing up, that has left a mark. The brain has anchored that moment as very significant. So they are not comfortable in their own skin. So they have to find a way to cope with that. Like I said earlier, they can find drugs, alcohol, whatever. But to soothe, self soothe, a lot of people are introduced to sexuality at a very early age. In fact, pornographers target 7 to 11-year-olds.
Oh, really?
Yes, they just do. And they do that very manipulatively and cunningly. They deliberately misspell words, thinking that kids don't know
Hmm.
how to, for instance, like dolphins spell with an F instead of PH. So kids will type that in and boom, they're introduced to a website. And at that point, of course, they feel this euphoria, this intensity, and pretty soon the brain remembers that. It says, you know what? You can go back to that. That felt great. When you were scared, when you were afraid, when you were upset or whatever, we did this.
Hmm.
And so the brain has this neurochemical way of leaving, chemical cookie crumbs
Yeah.
for you to return to a behavior that felt good. Now, it wasn't appropriate or it wasn't healthy, but the brain decided that, that felt good. So yeah, there was trauma, but I found a way to deal with that pain. Again, a lot of people drink, a lot of people do drugs, but the internet is pervasive.
Yeah.
So
Yeah. And so, kind of looking bigger picture now,
yes.
what's one thing that you wish the general public understood better about this conversation about sex addiction, trauma, all that?
Wow, that's a good question. I if I had one wish, it would be that people would acknowledge and try to understand that this is truly an addiction. I know there are a lot of people out there who don't believe that sex can be addiction, but there's more and more research. In fact, ASAM, which is the American Society for Addiction Medicine, which is comprised of neuroscientists, neurologists, psychiatrists, and physicians, they did 4 years of research and they concluded that sex is an addiction too, along with gambling and eating and drugs and alcohol. So that would be my wish for society um, to permanently destroy the ignorance that exists in our society about that. That this is an addiction and people are truly suffering. This is not an addiction that you want to have. I've heard people jokingly say, if I had an addiction, I would love for it to be sex. Trust me, you do not want this.
Yeah.
It will kill you.
Yeah. Yeah. And so, just wrapping up here,
Yes.
what would be one book, resource, speaker, something like that, related to this that you'd recommend?
The resource, of course, I would go to is the International Institute for Trauma Addiction Professionals, ITAP, which Dr. Karn started for clinicians. And they have a lot of books there. And some of the finest clinicians in this country and in the world actually are part of that organization. Uh, but the basic is, Dr. Carnes is Out of the Shadows, trying to understand sexual addiction. That was the first book I was introduced to and makes a lot of sense.
And it's still relevant.
It's still
Yeah,
relevant,
yeah.
yes.
All right. So, final question: what would be one piece of advice, something that you find yourself passing on again and again that is meaningful to people going through this journey?
That you are not alone. You don't have to do this alone because you can't. And there are people out there who can help you. So if you can muster the courage to step out of isolation and reach out, there are people there who can help you.
Yeah. All right. Well, Dr. Betjoseph, thank you so much for your time.
Thank you so much for having me.
Yeah. Dr. Invia Betjoseph is a licensed marriage and family therapist and a certified sex addiction therapist based in Los Gatos, California. In addition to his private practice, San Jose Counseling, he also provides individual therapy at the Meadows Outpatient Program in Silicon Valley. Learn more at meadowsiopsv.com. Beyond Theory is produced and hosted by me, David Condos. You can discover more from this podcast, including videos of each conversation, at beyondtheorypodcast.com. Finally, thank you for listening, and I hope you'll join us again next time for another episode of Beyond Theory.